Jennifer is a 14-year-old patient who has been diagnosed with diphtheria and subsequently, myocarditis. The nurse implements all of the following except dash. A. Practicing standard precautions. B. Enforcing bed rest. C. Administering antitoxin. D. Administering antibiotics. E. Practicing airborne precautions. The answer is E. Practicing airborne precautions. Diphtheria is an illness caused by bacteria, Green Bacterium diphtheriae. It is spread through droplets, requiring droplet precautions. Standard precautions should also be used, as with any patient. Delivery of antitoxin and antibiotics are important to a patient's recovery. Enforcing bed rest is important after a patient has developed myocarditis, inflammation of the heart. A community health nurse is giving a presentation on pertussis, whooping cough. He tells his audience that which population is most at risk. A. Older adults above 85. B. Older adults from 65 to 75. C. Older adults from 75 to 85. D. Children under 4 years of age. E. Children from 4 to 12. The answer is D. Children under 4 years of age. Children under 4 years of age hold the greatest risk of contracting pertussis and developing serious complications, including death. Pertussis vaccines are recommended for all age groups. Children can start a vaccination series as early as 2 months of age. New parents are encouraged to become vaccinated before their baby arrives to prevent transmission before the infant is eligible for immunization. A room designed to accommodate a child with the measles should include which of the following? A. Negative air pressure. B. Low microscopy pressure device. C. Positive air pressure. D. No air pressure device is necessary. E. High microscopy pressure device. The answer is A. Negative air pressure. Measles is an airborne illness. For that reason, air pressure devices are necessary to prevent the spread of infection. Negative air pressure devices will adequately contain the measles virus because air will flow into the room as opposed to out. Conversely, positive air pressure devices may be used to create an airflow out of a room in severely immunocompromised patients. The school nurse is approached by a 9-year-old boy who is complaining of severe scalp pruritus. Upon closer examination, the nurse concludes that he has a case of head lice, pediculosis capitis. She knows all of the following to be true except dash. A. Treating the clothing of the child may be necessary. B. His personal grooming items should be soaked in hot water or shampoo. C. Sealing his backpack in a plastic bag for 10 days should kill the lice. D. His 5-year-old sister should be examined. E. Head lice may be a sign of poor hygiene. The answer is A. Head lice may be a sign of poor hygiene. Children and adults with exceptional personal hygiene are equally affected by head lice. The same applies to people of all socioeconomic groups, genders, and nationalities. All of the other options are true nursing interventions for head lice. A school nurse is holding a question and answer meeting for parents following a recent outbreak of scarlet fever. Which of the following would the nurse confirm is false? A. Scarlet fever is transmitted through the air. B. Children over 2 years of age are higher risk than children under 2 years of age. C. Scarlet fever is a viral infection. D. A rash develops secondary to toxin sensitivity. E. A child may or may not develop a rash after exposure. The answer is C. Scarlet fever is a viral infection. Scarlet fever is a bacterial infection caused by group A Streptococcus that is transmitted through the air. Children who are sensitive to the bacterial toxin may develop a rash, although some will not. Infants and toddlers under the age of 2 are rarely seen with the disease.